All right, I'm talking about the juxtaglomerular apparatus, or JGA. That's the part of the glomerulus here that helps control the kidney's regulation of glomerular filtration rate and renal blood flow. There are intrinsic and extrinsic pathways. First, I'm going to talk about intrinsic autoregulation of renal arterial pressure. So the juxtaglomerular apparatus controls this. There are three parts to it. There's the macula densa cells, which are part of the distal tube here. There's the extraglomerular mesangial cells here in the center. And then the juxtaglomerular cells, which juxta means up against, so it's up against the capillaries of the glomerulus right here. So there are two main regulatory systems for autoregulation for intrinsic. The first is myogenic response, and that would be affected by the extraglomerular mesangial cells right here. So it's called the myogenic response because these are stretch receptors, and they're going to feel when the arterioles are stretched from a high arterial pressure. And so what the myogenic response wants to do is to decrease the renal blood flow and glomerular filtration rate because it's too high. So those stretch receptors get activated in the extraglomerular mesangial cells. That will open cation channels unpreferentially. So when the calcium channels come in, that depolarizes the cells, the smooth muscle cells. So that will lead to muscle contraction, and specifically or preferentially for the afferent arterioles, which will increase resistance and lead to decreased renal blood flow and glomerular filtration rate. The second type of intrinsic autoregulation is called the tubuloglomerular feedback mechanism, or TGF, which also will detect increased arterial pressure, but this time it's done by the macula densa because they're in the distal tubule, so they're going to be able to have chemical receptors that detect the increased sodium chloride. There will be increased sodium chloride if there's an increased arterial pressure. And so this feedback mechanism wants to decrease renal blood flow and glomerular filtration rate. So these chemical receptors, they detect that increased sodium chloride, and they release vasoactive agents, which will lead to an afferent constriction. So the reason why this is clinically significant is because if you take loop diuretics, it can disable the macula densa's ability to detect sodium chloride. And also, if your patient is in acute tubular necrosis, this system can decrease sodium chloride loss. So those were the intrinsic autoregulation for the regulation of glomerular filtration rate, and also detects or regulates renal blood flow. But now we have the extrinsic controls, which can come from other parts of the body. First, I'm going to talk about angiotensin II, and that preferentially affects the efferent arterioles, and it will constrict them or dilate them. And so I think of angiotensin II, since it's 2, it's the second part of the glomerulus, so the efferent going out. And then prostaglandins are afferent because pro means like before, so afferent is the first one, it's going in. And so the afferents will dilate, efferents will constrict. I'm sorry, I said that wrong the first time, because both of them want to increase the glomerular filtration rate. So if you constrict efferent, that'll increase glomerular filtration rate but decrease renal blood flow. And if you dilate the afferent arterioles, that will increase glomerular filtration rate and will also increase renal blood flow. Next, you have sympathetic tone, which is moderated by norepinephrine and epinephrine, and that can preferentially dilate both the afferent and efferent arterioles, which will have an increased effect on GFR and renal blood flow. And then the fourth is ANP and BNP. For instance, ANP is secreted by the atria in the heart when it detects high blood pressure and there's damage sense, so ANP is released and it affects the kidneys to decrease sodium reabsorption, because if you decrease the sodium, then you decrease water, so it's your body's way of trying to decrease the blood pressure. And that's an overview of the juxtaglomerular apparatus.